Do you love singing? Do you love music? What if I tell you that singing and music not only can fill all of us with joy, with energy, it also connects us with others, it fills us with very positive and vibrant energy. But what if I tell you music can also help someone to breathe better? Yes, singing does that, especially when it comes to a population that is experiencing any kind of difficulties when it comes to breathing. And that includes spinal cord injury participants or volunteers. So those are the ones that is actually related to our project today. Hi, my name is Dr. Muhammad Imran Ramli, and I am a senior lecturer from Department of Biomedical Engineering in the Faculty of Engineering in University Malaya. So ever since I was a child, I always have this passion between science and arts, particularly biology and music or singing. So what if I tell you that the inspiration behind this project was actually kind of similar? So back then, before I started my PhD project, one of our co-researcher, Professor Dr. Julia Petri, and as well as Associate Professor Nur Azah, came to me because they were looking for an engineer to actually quantify, to measure, and also to monitor muscle performance among people with spinal cord injury during singing therapy.
At this point, there were very little research known out there that implements singing therapy as a therapeutic tool among people with spinal cord injury. Therefore, the research is developed to bridge this gap to help people with spinal cord injury to breathe better.
So when Professor Dr. Julia and Associate Professor Nur Azah came to me, at that point, there is very little to no existing literature when it comes to implementation of singing therapy, specifically for spinal cord injury population. So what we did back then was we collaborated and we try and error and we see how can we measure and quantify muscle performance among spinal cord injury during singing.
The spinal cord is like the body's superhighway of communication. It sends messages between your brain and your body, controlling movement, sensation, and even the muscles that help you breathe. But when the spinal cord is injured, whether from an accident, a fall, or a medical condition, those messages can get blocked or lost. People with SCI may lose the ability to move their arms or legs, and often they struggle to breathe properly. SCI in the neck or chest area often weaken breathing muscles, making it harder to take deep breaths and increasing the risk of lung problems. The findings of this research conclude singing is more fun and natural way that would help, gives the lungs a workout while encouraging deeper, stronger breathing for the patients.
So how does singing actually contribute to improving the respiratory dysfunction among spinal cord injury population? Well, imagine if you go to the gym, for example, you want to gain muscles of your bicep, for example. You do bicep curl, right? You do that, I don't know, probably every day. Probably one day you would probably go from half an hour to 1 hour to 1.5 hours. That's kind of the same concept that can be applied to breathing as well. So imagine when it comes to music, you have a lot of parameters. You have tempo, you have pitch, you have rhythm. So those are the things that actually will affect how your muscles will be used during singing and also breathing.
Rasa sayang, hey, rasa sayang, sayang, hey, hey, lihat nona jauh, rasa sayang, sayang, hey.
Nice, that's good. Yeah. To go, hold me now, touch me now, I don't want to leave.
So these 4 categories will be divided into these parameters. For example, the first category is slow tempo and easy rhythm and low pitch. So moving forward from that category, you will increase from low pitch to high pitch. And then, for example, another example is that from slow tempo to high tempo or fast tempo, and then from easy rhythm to hard rhythm. Alright, so those are the 4 categories. So what we did with our spinal cord injury participants, we asked them to sing one song from each category. So each song will actually only comprise of one verse or one chorus or one intro, for example. Alright, so after that, we will use our mechanomyography with the vibration sensors or accelerometer to measure the muscle performance during singing. And what we did and what we got after all of the data process and data collection, we found out that spinal cord injury participants actually utilize their respiratory muscles differently with different parameters of song. So this is the device that our team has been using all this time when we are collecting the data with our spinal cord injury participants and volunteers. So this device is called Mechanomyography or MMG, right? So you might think it sounds pretty familiar with another device. That is true. It is called electromyography or EMG. So yes, EMG is the gold standard when it comes to devices that measures muscle performance or activity. But there are some differences and pros and cons when it comes to when you are comparing MMG and an EMG. So one thing that MMG does but EMG does not is that MMG actually detects and measures the vibration of the muscle performance. Alright, so it is a complementary device to electromyography. So imagine when someone is singing, let's say I put one sensor. Okay, so this is called accelerometer. It is made of accelerometer as well. So when you put it on any muscle, so in my case, in our team's case, we target 2 muscles, the neck and as well as the abdominal. So let me click start. Okay. Alright. So notice that there are some differences between inhalation and exhalation muscle signals. So focusing on the blue colored muscle signal, you can see that, for example, from here to here is your inhalation, for example, and from here to here is your exhalation. So that's how we collect the data, we quantify, we measure, and we monitor the data that we collected with spinal cord injury participants. So basically, yes, it is actually pretty relatively newer compared to electromyography, but it is also important to use MMG instead of EMG sometimes because both are complementary of each other. So if you go out there and look out for literature, existing literature and study, there is not much study that use mechanomyography. So what our team decided was that it is important to use not only a newer and relatively newer compared to EMG device, in this case MMG, but it is also important to get a new data so that we can get a better evidence so that it can actually improve what we are trying to aim at and our goal at the end. And alright, I think that's it. So what the main outcome that we got from this project is that generally, if you want to improve your neck muscle, let's say C3 to C4 of spinal cord injury level, your neck will be affected after injury. So if you want to improve this muscle, the finding that we got from our project is that you should focus on songs that is actually in high pitch. Okay, so On the other hand, if you are focusing only on the abdominal muscle, for example, if you want to strengthen that muscle, you should focus on slower tempo songs. Other than that, we also found out with using our mechanomyography or MMG, we found out that the muscle performance between first time of singing until the last time of singing is gradually decreasing. So that actually already gives you a lot of information where spinal cord injury participant or volunteers is experiencing a trend of muscle fatigueness, for example. And then the third finding that is quite important as well is that when our team compared the data between the spinal cord injury and the healthy participants, we found out that the neck muscle and the abdominal muscle in spinal cord injury participants are higher than healthy participants. So we concluded, or we assumed, that this is because among healthy participants, they don't have any injury in the spinal cord, right? So therefore, their diaphragm is still intact. Therefore, they are still mainly use their diaphragm as a way to breathe and sing while we are doing our project. But compared to spinal cord injury participants, we found out that they are using the neck and abdominal muscles more because their diaphragm is affected with the injury. So what does this project contribute? So this project actually contribute a lot, and one of them is actually by doing and collecting a lot of this data, we also were able to compile them in the form of a preliminary clinical guidelines. So even though it's a preliminary, it is quite extensive where we can actually guide any clinicians or patients among spinal cord injury population that if they want to implement singing therapy in their breathing technique, for example, they can use our clinical guideline properly and more importantly safely, so that whenever they are trying to sing, they know which muscle is actually they are trying to target to improve. Our main goal is that, or our hope at least, is after this we collect more data. We want to continue this data by using randomized controlled trial study, and of course we have to have more and more participants among spinal cord injury and healthy participants as well to actually finalize everything. And in the end, we want to come up with a comprehensive clinical guidelines that is approved by our MOH or Ministry of Health. Therefore, we can use singing therapy safely, not only in hospital, but also safely at home for our patient to improve their respiratory dysfunction. That's all from me. Thank you for listening.